So if you're a dog owner dealing with chronic allergies, you know the drill, right? The endless scratching, the vet trips, and then the medication that works like magic, right up until the moment you stop it. In this explainer, we're going to dig into why those powerful allergy meds can feel more like a pause button than a permanent solution. And this right here, this is a story we hear from dog owners all the time. It's that feeling of being stuck on a hamster wheel. You finally get some peace, your dog seems comfortable, but then, boom, a few days after the meds run out, you are right back at square one. It's exhausting for you, and you know it's miserable for them. So that's the big question, isn't it? These drugs, like steroids or apoquel, they obviously work. They stop the symptoms dead in their tracks. So why can't they just, finish the job? Why can't they deliver a real, lasting cure? Well, to get to the bottom of that, we have to look way deeper than just the skin. Okay, so first things first, let's break down what these medications are really doing inside your dog's body. Because their job isn't what most of us think it is. They're not actually fighting the problem, they're just shutting down the warning system. They actually take two totally different approaches. Steroids are kind of like a sledgehammer. They just suppress the entire immune system to shut down inflammation across the board. It's like putting the body's whole security team on furlough. Apoquel, on the other hand, it's more like a sniper. It takes aim at one very specific thing, the nerve pathway that screams itchy to the brain, and it just blocks that signal. Okay, here is the absolute best way to think about this. The real problem, that deep internal inflammation, that's a fire, and it's burning inside your dog's body. All that itching and scratching, that's just the fire alarm, blaring at full volume. And what does the medication do? It just walks over and yanks the batteries out of the alarm. The noise stops, which is a huge relief for everyone, but that fire, it's just left to smolder. All right, so if the skin is just the alarm system, then where in the world is the actual fire? Well, functional medicine is pointing to a place you might not expect, the gut. This is where the whole problem really gets started. This all comes down to a really fascinating concept called the gut-skin axis. And it's exactly what it sounds like. It's a proven direct line connection, a biochemical highway really, between what's happening in the gut and the health of the skin. What happens in the gut absolutely does not stay in the gut. And this is the real kicker. That inflammation bomb that we see going off on a dog's skin, the thing causing all that misery, it isn't actually built on the skin. It's being assembled piece by piece down in the digestive system. So how does this happen? Okay, picture this. A healthy gut has this really strong, tight lining that acts like a security guard. But when that lining gets damaged, it starts to get these tiny gaps in it. That's what we call leaky gut. And through those gaps, things like undigested food particles and other toxins can leak straight into the bloodstream where they don't belong. The body freaks out, sees them as invaders, and launches this massive immune attack. And that battle, it very often erupts right on the surface of the skin. And this is why everything comes roaring back the second you stop the meds. All that time, the leaky gut has just been pouring inflammatory fuel into the system. The medication is basically a dam, holding it all back. The second you remove that dam, all that built-up pressure is released, and the symptoms come back, sometimes way worse than before. That's the rebound effect. But what happens when you just keep taking the batteries out of the alarm year after year? Well, it turns out that just ignoring the fire doesn't just let it smolder. Over time, it can start to damage the whole house. This is where a really cool idea from functional medicine comes into play. It's called terrain theory. Think about your dog's body like it's a garden. The theory says that disease isn't just about a bad seed, like a germ or an allergen. It's really the condition of the soil, the body's whole internal environment that determines whether that seed can grow and cause problems. And yeah, using these medications for a long, long time can kind of start to pollute that internal soil. For instance, chronic steroid use can disrupt the whole metabolism, leading to things like insulin resistance or liver problems. Apoquel works by dampening parts of the immune system, and over time, that can lower the body's ability to keep an eye out for other threats, like tumors or different kinds of infection. And really, this is the biggest long-term cost. When the body constantly relies on an outside drug to handle inflammation, its own internal systems, the ones designed to self-regulate and heal, they just get weaker. It's like they forget how to do their job, and the body loses its natural ability to stay in balance. Okay, so that all sounds pretty bleak, right? But what's the alternative? Well, it means we have to make a pretty big shift in how we think about the problem. We have to move away from just suppressing everything and start thinking about reconstruction.
I mean, when you put the two approaches side by side, the difference is just night and day. The old way is all about the symptom, right? It's about getting temporary relief, just managing that loud alarm. The new way? It's about finding the root cause to get long-term healing. It's about actually putting out the fire.
So how do we actually put out the fire? Well, this reconstruction idea really boils down to three key pillars. First, you have to heal that gut lining to stop the leak right at the source. Second, you give the body deep cellular nutrition to repair all the damage that's been done. And third, you work to reset the metabolism, creating an internal environment that's calm, where the immune system doesn't feel like it has to be on high alert all the time.
In the end, it all comes back to this one really powerful idea. Instead of just suppressing the problem, the real journey to health is about reconstructing the body from the inside out, one cell at a time. It forces us to ask a better question. Not just, how do we stop the itch, but how do we build a body that doesn't need to be itchy in the first place?